Welcome to Coda Zero Earth. My name is Kate Charlesworth. I'm in Sydney in Australia, and together with my colleague Forbes McGain in Melbourne, we will be co-hosting today's episode. Firstly, we would like to acknowledge the traditional custodians of the land on which we meet and to pay our respects to elders past, present and emerging. Wherever you are in the world today, we ask that you also take a moment to acknowledge the traditional custodians of the land on which you stand. Today we are proud to collaborate with Teleflex, who are supporting this educational event. Teleflex are passionate advocates for advancing the cause of sustainable healthcare and corporate social responsibility in the medical device industry. I think we'll move on to conversation 2 then, thank you, which is about climate change as an issue of social injustice and health inequity. So climate change is affecting all of us. As Tim mentioned, just look at Australia's Black Summer. But we know that it's the most vulnerable who are being hit the first and the hardest. It's children, it's the elderly, it's poorer communities, Indigenous groups and so on. So climate change is not just a threat multiplier, but a vulnerability multiplier and an inequity multiplier. Omnia, you're a medical student in Cairo and also an advocate within the International Federation of Medical Students. And so you're hearing from medical students all around the world. What are the biggest issues in Egypt and also from your fellow students in other countries?
Yeah, so from my perspective as a medical student currently working in my teaching hospital in Cairo. So Cairo is one of the biggest cities in Egypt with the highest rate of air pollution. I see patients every day suffering from chronic diseases, especially respiratory ones, including asthma, most of them exacerbated by air pollution. These patients also do not have access to and cannot afford the medications for chronic disease or even afford the follow-up tests that they need. And in Egypt, we also don't have universal health coverage. So this is one of the inequalities that I'm seeing because their chronic illnesses are exacerbated. But at the same time, as a youth advocate within IFMSA, and we work and represent more than 1 million medical students around the world, we also see a different kind of injustice, which is the intergenerational injustice, because we try to advocate on a global level, but also on a national level with our countries, but yet we are not meaningfully involved in the decisions that are especially related to and impacting our environment. So this really poses intergenerational injustice because this is our future, yet we do not have a say in how it's going to look like.
Thanks. I mean, I think that's a really important issue, that question of intergenerational justice, and a lot of us as parents will come on to that. But firstly, just, Michelle, if I could come to you, because it's not just, of course, developing countries which are affected, but rich countries like the US and Australia have a lot of communities which are most affected. We know, for instance, that during extreme heat, it's the poorer communities and particularly the people who live alone or who are socially isolated who die in greatest numbers during a heat wave. In the US, which communities are most affected by the climate crisis and what, if anything, is being done about it?
Sure. So here in the US, disadvantaged and vulnerable populations are coastal communities, certainly. They're people of color, women, low-income communities which are adversely impacted. And one of the great challenges that they face, while they're the reason that they're the hardest hit, is they really don't have the resources to adapt to what they're faced with. And that's true whether they're dealing with severe weather changes and coastal flooding. We certainly saw that following Hurricane Katrina and Hurricane Harvey. But it's also true in this pandemic and infectious disease. We've seen that there's been a disproportionate impact to these vulnerable populations and communities that are disadvantaged. There's several strategies that are being implemented to try to address this, but I think that it's really imperative that we integrate specific attention to these vulnerable populations to really be effective. So industry, I think, can play a great role in this, for example, certainly with corporate social responsibility, which is, one of the reasons we're so excited to be participating in this forum today. We know that there's a business approach which can be taken, which will deliver with an intent to support sustainable development for economic, social, and environmental entities so that all stakeholders are benefit from this approach.
Okay, thanks, Michelle. And Courtney, could I just ask you, in terms of, I know you have a lot of Indigenous patients in those communities where you work, and are there specific issues in Canada, or do you think they're generic issues worldwide?
Well, what's been such a gift living here, I do work in a majority Indigenous place. It's my patients who've helped me understand these connections. So Indigenous people are really the original practitioners of planetary health. And when I was originally going to Canadian Medical Association meetings and saying climate change is a health issue, and they weren't ready to hear that right then, I'd come back and I'd be thinking to myself, is it me? Like, I'm pretty sure the Lancet says that this is the biggest health threat of the 21st century. I would sit down next to an elder like Francois Paulette or Bessa Blondin, and they would say, keep going, doc. And so really, they've been some of my biggest supports and sources of inspiration in this. And certainly because they live so close to the land, people in this areas, a lot of their lean protein still comes from hunted game or from fish. Health Canada is already saying that there's food security impacts, certainly mental health impacts. One of the first places they were described was in Northern Labrador by Ashley Consuelo, when people are talking about basically solastalgia, which means feeling homesick when you're still at home because of the changes in the landscape, permafrost slumps, trees tipping over because their roots sort of lost their footing. And so I think that really we need to realize that, biodiversity is highest in areas that are managed by Indigenous people. And there's really a tremendous amount we can learn from them as well as from the impacts that they're already facing.
Yeah, okay, great. So now I'd like to pick up on the issue that Omnia raised, which was about intergenerational equity and the question of what we're handing over to our children. And Omnia, I'll ask you, but some of the things that young people say to me in Australia is that they're not only concerned about the scariness about the climate impacts, but the thing that really worries them is that leaders and governments' complete failure to acknowledge the scale of the problem and failure to act on it, that they, find quite frightening, because it's almost like there's no adults in charge. There's no one, stepping up and taking charge of that. As a young person, what's your perspective?
Yes, so for me, since I began advocating in the climate space, I've been seeing really prominently, the lack of urgency, B, the lack of engagement of us as youth, and the last one is the lack of education. So when it comes to engagement as youth, we really represent a unique link between the communities and the civil society and governments. And yet our engagement in any conferences or consultations is not meaningful, nor is it sustainable in any way, even though we can give these policies the sense of urgency to be transformed, similar to what we're seeing now with COVID. And at the same time, I also see a lack of education. I'm a medical student now, seeing every day the impacts of climate change in the patients in my hospital. Yet I've never learned about climate change in my own curriculum, nor did 85% of medical schools around the world have. So there is also the need to have that kind of education in our own curriculum as healthcare professionals, but also as youth and students around the world.
Thanks, Omnia. So for the rest of us, with the exception of Omnia, all of us that are on the panel are parents, as are many health professionals. And we're very well aware of the fact that our actions, as Tim has said, in the next 5 or 10 years are going to determine the climate for decades to come, and our children won't have time to fix this, the climate crisis is happening on our watch. And so, Michelle, could I ask you, what's your experience as a parent, and how can we use that shared identity to connect with other parents?
Sure. So I have 4 daughters. They're 11, 12, 15, and 23. So there is a lot of conversation on this topic, and that's just every day in our house. But then I also fully am aware that there is a constant stream of information that they are on the receiving end for. And they are in real time hearing about these natural disasters, in real time hearing about the pandemic and other world events such as politics. So they've had a lot of emotions, really appropriate emotions, everything from anger and frustration and sadness and fear for their future. So I have, just to be totally transparent, I've struggled at times as a working mom to try to figure out how to support all of this, especially when we were isolated and in quarantine. And so things that we've done in our house is really just to remind them to stay connected to the earth. Like, get out there and hike. You can socially distance and do that. To do things to take care of themselves, meditation and yoga, but also most importantly, shared what I'm doing. I chair our humanitarian donation program at work and our medical education grants. And I've talked to them about, at Teleflex, we've been able to provide $1 million in grant support. And that's going to populations that really need that support. And I've encouraged them to also use the resources that are available to them. So I've got 3 vegans and a pescatarian now because they want to lessen their footprint. We are eliminating plastics. We're talking about good decision making as consumers. One of my daughters wrote an article around fast fashion and the impact of that. And then we're volunteering where we can.
Great, thanks, Michelle. And I'll come on to Tim in a minute, but just Courtney, I know that you've looked into some research around eco-anxiety in children and young people and what we can do. Can you tell us about that?
Thanks. Yeah, this is a really emerging topic. So when some co-authors and I looked at this just before the pandemic, one of them knew how to figure out how many searches had been done in Google, and it was going like this for eco-anxiety. Kids surveyed in the UK were really indicating huge levels of anxiety. And what's important when we consider that this is a threat that affects us all. So from a mental health perspective, we're sharing the same threat as our kids. And when we think about the emotions this brings up in us, things like anxiety, fear, worry, we need to have insight into our reaction because that is going to really affect our children. And so we talk about discussing this as a family. We talk about the necessity for self-care for each of us. So filling up our bucket with things like what was described, making sure you're appreciating the day, going for walks, etc. But what's really fascinating in the psychological literature is that action feels better than anxiety. So the very act of coming together, when you think about what a support group is like, immediately you're no longer lonely in your worry, which is one of the worst things people tell me about. Almost every time a year ago when I used to give presentations, someone would come up to me at the end and with tears in their eyes and say, I thought I was the only one who was this worried. People need to know it's totally normal to be worried. You are responding to an external threat. We can look at this as a cue, a constructive, unpleasant emotion that we need to change what we're doing. And so coming together is going to feel good. And that builds the civil society that we need to take productive action, because this is about changing the system. And there's further evidence that shows that having those wins is empowering and feels great. So the best part about this is that the best way to make us feel better is to solve the problem.
Yeah, I love that. Action feels better than anxiety. That's a really good one. And also the fact that, this is a lot of people have said, this is not anxiety, this is an appropriate response to the crisis that we're seeing, you'd be worried if you weren't. And Tim, just finally, you wrote an article last year saying the gloves are off, talking about how climate deniers are, I think, predatory threat to our children. Can you tell us about that and your perspective on this?
Yeah, sure. Look, I rarely give myself the luxury of being angry because I've got to stay focused on creating change, But I remember watching some politician, climate skeptic on TV, and he was kind of enjoying it, poking at those who are concerned about climate change. And it just suddenly, I just found myself saying the words, stop threatening my children. And that's exactly what I felt. And it is very true that when you see those people who are acting in their own self-interest to destroy my children's future, it makes me every bit as angry as any other sort of predatory action that would concern my children. So I find that if I say that to people, sometimes it pulls them up and gets them to think at least a little bit about what they're saying and doing. But it is very true, because their actions are holding back action at a critical time in a way that will destroy my children's future, at least the full potential of their future. And that's intolerable. We cannot have that.
And do you find that's a key motivator for a lot of people? Because if you really think about it, your key job as a parent is to, provide a safe environment and a safe future for your children. So it comes back to that fundamental responsibility, or what do you find?
Look, it feels very much that way to me, and I cannot understand people who don't get that. So we just need to shift our thinking and understand these future impacts. I think part of the problem is a lack of imagination, maybe. But now that we've seen the bushfires and we've seen the floods and we've seen the heat wave, surely people have enough imagination now to see that this is going to continue to get worse to the point where their children's lives will be compromised.
Yeah. Okay, thank you, Forbes. There's a few minutes left for audience questions. I'll hand over to you.
Yeah, in fact, I haven't got any questions at the moment, and in the interest of time, we could roll on. Given that there's all sorts of exciting stuff still to come, unless Kate, you wanted to dwell on anything.
That's fine. Over to you for conversation 3. Very exciting.